First, I would like to give you the an overview of the today's global healthcare environment. We have, as Octavian mentioned here before, globalization and increasing all costs for chronic diseases, and how can we counterfight these? We have also the pharmaceutical companies and all health workers trying to strive for a better health care. Nevertheless, we have so many of our health disorders today that are resulting actually from our daily life routines. And each day we are doing things which are maybe not so good for our health. And there are many of these that we could, by the ICT, be empowered and learn more about how can I do for have a better health, how can I prevent from having problems like diabetes, like how can I prevent HIV, how can I prevent malaria, how can I prevent death at birth just because washing hands or because having a net for preventing malaria. Many people are not aware about these issues, and ICT provides the tools for making this awareness. As you can see, we are now looking into a very stagnant wheel where the government likes to invest in what we call the equipment industry and research in technology in the technical universities or in the other, and also in the biotech and the chemical, on the pharma industry. Whereas these fields in red, there we have weaknesses. And one of the weaknesses is the organization of health authorities and also the patient. Costs are rising and we have to do something about it. There we can use ICT, and I think that by using empower people by the means of ICT, we can get this wheel spinning again in a different way. We need to have all of these four factors working together, otherwise we will not be able to have a change when it comes to lifestyle-induced health disorders. What do we need then? We need to give people the right tools to change behavior. To change behavior is actually the most difficult that you can do. And everybody knows that. So how can we do it? Yes, we have to use a methodology to change behavior. And that has been worked out by our researchers and organizational team through a special we have to provide incentives, because the incentive to be healthy the incentive lies too far away in the sector. So you have to give the incentive very quickly, and ICT can do that. You also have to have involvement with other social relations, and ICT can do that. Furthermore, you need to have direct interaction, the interaction that you are lacking when you are meeting the doctor. When you have been at the doctor's office, you feel empty because there was not or very little interaction. But ICT can provide the interaction that is necessary for behavioral change. I will see that in this field we think always about we have to cure, we have to help, we have to see, but it's really about giving people the little incentive to change only one thing. So our scheme is built upon a speciality of seeing the whole picture and depending upon the health disorder, seeing what we need to change for having the least impact for the biggest output. And that is our main scheme. To use this, we see that we have a scope for innovation through ICT. We can use the websites, we can use the mobile phones, because with the websites you get interaction, you make it simple, you can make it social, you can create incentives in a very short time. Whereas it takes 20 years to develop an obesity or to a cardiovascular disease, we can have here an incentive that gives you feedback directly, and you will see a change in behavior in a different way. And this is used now in different ways. We have a testing now going on diabetes in the Middle East. We have a testing going on in the US on obesity. We have in Northern Europe on depression, where the person can type in their feelings, because the problem is often with depressive people that when they see the doctor, they cannot express, don't remember what happened even a week ago, but because of the fact that they have already got it into the system, the doctor can then spend less time with the patient and be more efficient. And there will be a more interactive scheme because it's already on the screen, or it's already in the mobile or on the computer. Now Octavian asked us here, I said that we should have a business model for this, so who will pay for it? In the United States, there is the health insurance companies, they have an incentive here to lower the insurance rate if you take on this kind of learning process. In the Northern Europe, it's the employers that are interested in paying for this because they will have a healthier workforce. So there is a business model to it, there is the behavioral change methodology, and a step-by-step approach that I would like to discuss more with you when after dinner. So I will not take more time of your valuable time and my valuable speakers also. So thank you very much, and I'll be happy to answer all questions afterwards. Thank you.